Mike 1 2 1 2.
My check.
I
One,
just want
one.
to do that, bro. You guys are hilarious. What the? Anyway, all right, let's get started. Let's go ahead and put our PPE on. Okay, put your PPE on. All right, that's your mask and your gloves. We have real simple PPE for dental work. All right, mask and gloves. All right, you can wash your hands too. Slash do sterilize, wash hands. Slash do put PPE on. Then I want you to go ahead and get Miss Rayana set up with a top gown, so you can just give her a gown, and she could put that bad boy on. Okay.
Miss Queen. Hold on, put my macro in. Oh.
Usually for this, I'm not gonna lie. You could put the macros in beforehand, and I'll give you a set amount of macros. But for certain stuff like that, I have these macros within my list of procedures, probably like at least 2 or 3 times, depending on the different procedures. But I usually just type them out. Honestly, I'm not gonna lie. When small little macros like that, I have over 200 macros with different stuff, right? So small little
Oh.
macros like this, I just type them out. You know what I mean? Um, and then the other macros, I'll give you those. They're for the actual procedure, okay? And you don't have to worry about that right now. Don't worry about none of that right now. Just type each one out as of right now, okay?
Okay.
Awesome, awesome. And that was perfect. Top gown, yes. How'd you know that? We use top gowns in dentistry. We don't put the whole, you know, what's it called, top and bottom gown on. Just a little top gown that goes over the top half of your body. Yeah. So that was awesome. Good job.
Thank you.
No problem. Next, I want you to go ahead and sterilize the room and turn on the computer systems. All right. Thank you, Miss Rayana, for putting on the top gown. Awesome. Awesome. I'm going to go ahead and gently lay you back. All right. Awesome. And you can sterilize the equipment. How about that? Sterilize the equipment and turn the computer systems on and machine computer systems slash machines on. All right. Then everything will be all set in terms of prepping. All right. Got our PPE on. The equipment's all sterilized. Um, and then computer systems are all on. All right. Awesome. Make sure you just type the slash do's out or the slash me's out or the slash tries out before. So it should turn into a color. It shouldn't be a basic white command. Exactly. There you go. Awesome. Awesome. Yes, ma'am. Good job.
Hey, thank you, thank you, thank you.
Awesome. All right. So what we're about to do first is go ahead and check the teeth. All right. So I'm gonna do an exam with the naked eye. I want you to go in there in the computers and sit there behind the desk. I'm gonna go ahead and capture some before pictures, update them to the dental patient portal, um, and then you can take a look at them as well. Okay. So
Okay.
go ahead and sit behind the desk in there. All right. Awesome. We gonna go ahead and check for anything. All right. So the dental light is gonna go over your head. I want to make sure it's not too bright. Let me know if it is. I can adjust it a little bit. I always like to ask before any procedure. This is my go-to macro. Can I go ahead and take a look in your mouth? Yes or no?
Yes, let me open it. Yes, you can.
Awesome. Thank you so much. I always like to get confirmation. Appreciate you. Thank you. Thank you. All right. And during the procedure, I'll have a cheek retractor where it keeps your mouth open by itself. But for now, yes, you can go ahead and keep it open yourself. Okay. Thank you so much. All right. I'm going to go ahead and use this dental mirror to go ahead and inspect your teeth and gums. Let me know if you feel any pain anywhere as I check, all right? And what I'm doing, like I said, I'm just checking for any swelling, bleeding, decay, or fractures, teeth fractures, any broken teeth, cracks, any cavities as well. These are all commonalities that we like to, check for. Press the wrong macro, I'm sorry. Yeah. And basically, I want to make sure that you don't have any inflammation. I want to make sure that everything looks good. Um, Everything does look good. All right. Basically, gonna rub your jaw, the outside and the inner part of your jaw, as well. Make sure you don't have any cyst, all right, or any problems with your cheeks, the inner part of your cheeks. All right. Do you have any sensitivity to hot or cold items, ma'am?
No.
Awesome. Okay. Awesome. 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 That's perfect. Okay. So now I'm gonna go ahead and take some before pictures. Okay. Let me go ahead and get some top rack pictures and bottom rack pictures left and right of both. Okay, give me 1 second.
Take your time.
Awesome. And let me go ahead and snap a couple photos. Give me 1 more second. Thank you. Perfect. 1 second. Now I'm about to go ahead and take a look over here. All right, what we see over here, Miss Certified? We see anything? See any problems? Any cracks? Any
No, they look good, actually.
look really good? Okay, nice and healthy. I do see a little bit of discoloration. Okay, and that's natural stainage. Are you a coffee drinker or a big candy person, Miss Rihanna?
I do have a sweet tooth. I do eat, junk food and stuff, drink soda.
Yeah, trust me, it be like that. I definitely get it. I'm gonna definitely just ask, especially with the braces, you're gonna have to cut down just a little bit on some of the sugary foods and drinks. Okay, I don't want any your braces are pretty much only for
That
your
moped, right?
spacing issues. Other
Yeah,
than
that
that,
moped
your
too,
teeth
bro.
are in perfect condition. No
Oh,
cavities, no other problems. No cysts, no gum infections. It's really just to help with the spacing issues that you're having and to kind of just tighten your teeth a little bit closer and give you that perfect healthy smile that you want. Okay.
okay.
Awesome. So let's go ahead and get started on the actual procedure, shall we? um Certified, can you go ahead and hand her the remote, or would you rather look at TV or listen to music, Miss Rihanna?
Can I listen to some music, sir?
Awesome, awesome. So yeah, Miss Certified, can you go ahead and give her you can still listen to music on the TV. We're gonna go ahead and put YouTube on the TV, hand you the remote. Miss Certified, can you hand her the remote, turn on the TV and hand her the remote? Awesome. Thank you. Or Miss Rihanna, you now have the remote. You could turn it on and put on the YouTube, okay? I just like to make sure that everybody's nice and comfortable, all right? So let's get started. And you can put on whatever you want, whatever your favorite artist is. You can put it in the chat or whatever, and you know. do your thing with it, okay? Let's go ahead and get started with the actual braces procedure. No problem, no problem. All right. One more second. Yep, today I'll be doing your braces procedure. All right, first is the preparation and cleaning. All right. So, I'm gonna go ahead and insert this cheek retractor in. All right, so that I can see your teeth fully and it keeps your mouth open without you having to hold it open the whole time. I know that gets tiring. All right. And we're going to start by thoroughly cleaning your teeth, all right? Just so that the adhesive that I put on can actually stick on after, onto some clean teeth, not dirty teeth, all right? And I'm Ag certified to basically just help me with that. All right, we're going to go ahead and do a thorough cleaning and scaling of the teeth. This is going to be to remove the plaque and tartar buildup. Plaque is just a natural buildup that happens mostly on the back side of teeth or in between teeth. If it gets really bad, it can happen on the front side of your teeth. All right, and basically it's just from food particles, saliva intake, mixing with the things you eat and drink. Also, you drink a lot of sugary stuff, eat a lot of sugary stuff. That hard substance can build and start to conform on your teeth. Okay, and it's our job to make sure that we clean your teeth nice and thoroughly. It's not too much, but it's a good amount of normal buildup, okay?
Okay.
Awesome. So, certified, can you hand me the scaler, please? The scaler. Just hand me that so that I can remove this excess plaque. Please. Thank you so much. All right. The plaque is now off. Everything looks really good. I like to even go a little bit further and do a nice fluoride treatment. So can you go ahead and get that set up for me, certified? And then I'll apply the fluoride treatment. It basically just protects your enamel or your teeth. Okay. And this is just another step that I like to do to make sure your teeth are really clean before these braces go on.
Am I setting up the fluoride?
Yes, ma'am. You can go ahead and set it up for me, please. And then I'll just go ahead and apply it. Thank you so much. And you can go ahead and you can help me apply it too as well if you would like. You can help me apply the fluoride. Thank you so much. All right. And I'm gonna go ahead and also apply a Profi paste to just remove any extra plaque that's on there as well. So I do pretty much 3 things. I don't have to do all of them, but I like to do all of them just to make sure your teeth are in perfect condition once again. All right. So I'm gonna go ahead and do mine. I'm gonna apply this Profi paste. All right. Next, I'm going to go ahead and get an etch gel. Etch gel just roughens up your teeth surfaces. So we just made it squeaky clean, all right, which smoothens your teeth a little bit. We have to roughen the outer part, the outside of your teeth, so that the adhesive that we're going to put on sticks onto it. If it's so smooth, it's not going to stick. We had to smoothen it because we had to clean it, but we also have to put the braces on there to make it stick, right? So we're going to go ahead and get that etch gel. All right, can you go ahead and apply the etch gel for me, certified? And I'll help you apply the etch gel as well. All right. And then I'm going to use a Transbond XT primer. That's just the adhesive that I like to use. 9 times out of 10 it works, okay? If it doesn't, I have another primer or adhesive that I use, and it's basically just brace paste, okay? And you'll probably see that if it doesn't work as well, okay? I'm gonna go ahead and assist just to make sure it goes faster. Thank you for that, certified queen, resident physician. Yeah, and now let me go ahead and get this Transbond primer on there as well, okay? And like I said, this is just an adhesive, okay? It seals your teeth and it takes out the extra moisture out of your teeth so that your braces can stick on there, all right? The brackets gotta stick. That's the main thing. It can't be smooth, no moisture, all right? If it is, it's not gonna stick, all right? So next I'm gonna go ahead and get these brackets on there. We're gonna position them carefully on each tooth, centered on each tooth, okay? That's our main goal. And what I'm gonna use to put the brackets on there is the Transbond XT, the adhesive, or the brace paste, which is another adhesive. Either one. Transbond usually works perfectly fine, but in this case, it seems like it didn't. And I'm gonna just go ahead and try to use it again. Maybe just have to add a little bit more, do a little bit differently, okay? Seems like the Transbond not working today, or at least with the mixing with your teeth well. So I'm gonna go ahead and try this brace paste, okay? And that's sometimes perfectly normal, you know. Sometimes you just gotta switch it up. That's why I have two of them. Certified, can you get the brace paste for me? Didn't think I was gonna have to use the brace paste, but it looks like I will. All right. Thank you so much. All right. Dang, the brace pace ain't working either. What's going on today? They don't want you to win. Okay. Let me go back and switch it up. I'm going to add just a little bit more and try one more time, okay? Oh, my God. Okay, so it looks like I'm going to have to switch it up and try something else differently, okay? All right. Certified, can you go ahead and apply the brace paste, please, for me? Thank you. Thank you so much. We're going to go ahead and apply that brace paste carefully on there. It seems like, you know, when I try, it doesn't want to work. It's not sticking on there carefully. And, you know, I'm going to try one more time with the brace paste.
There we go.
Maybe I just need a little extra hand. See, two people better than one. That's what I'm talking about. All right. So now we're going to go ahead and carefully center each bracket on each tooth individually. So you can assist me with that as well, Queen. Basically just putting each bracket on each tooth, each individual tooth, okay? Where the brace paste is. So the brackets stick in the middle, centered, all right? You have a lot of healthy teeth now, and it might take a little moment. So two people, like I said, gonna make it a little bit faster. Appreciate you. Thank you. Thank you, Certified Queen, once again. All right, and now this is my favorite part. I'm not gonna lie. I love this bad boy. This is the LED curing light. So in order for that adhesive to stick and harden, I use a Valo Ortho cordless. Okay, that's one of my best machines. I love this. I'm not gonna lie. It just emits blue wavelengths. Okay, and it helps harden that adhesive so that it sticks. All right, with the brackets on there. Okay. All right, so let me go ahead and use that, and let me go ahead and get the light ready. Usually 420 nanometers is perfect. If it doesn't work, I'll up it to its highest setting, which is 480 nanometers of wavelength. Okay, but let's try to start off at 420. Okay. 420 didn't work, which means it's not bonding as fast as I want. It's not hardening up as fast as I want. And I don't want those brackets moving. I don't want them sliding or, you know, coming out of place. I want them to be straight in a line so that when I put the wires through, they're even and nice and straight. So let me go ahead and up the nanometers so that it sticks a little faster. All right. And I'm just going to go ahead and adjust it to 480. All right. Perfect. This looks like it's providing a faster bond. Everything looks good. All right. Next, we're going to go ahead and slide these arch wires through the brackets. Okay. And this is we're almost done. Trust me. Going to put these arch wires through. All right. Can you go ahead and give me the pliers, Queen, please? And you can help assist put the wires through the top and bottom racks as well of the brackets. But first, you can hand me the pliers, please. The pliers. Thank you. Thank you. And I'm going to go ahead and insert these pliers using the arch wires. I'm going to go ahead and Put the arch wires through with the pliers on the top and bottom racks of your teeth. Okay. Lastly is the elastic bands, and this is where the colors come into place. A lot of people, like I said, think the color comes from the wires or the brackets. No, the colors come just from the bands placed around the brackets, which are called ligatures or O-rings or elastic bands. Okay, so we're going to go ahead and put these elastic bands on there. Certified, you can go ahead and get the purple elastic bands. I made sure that I had them. I know that's the color that you wanted, Miss Rayana. Like I said, this is where the color comes into place. We're going to go ahead and get you set up so that, you know, every time you smile, it's going to show that nice, lovely purple.
Hey.
What they be saying, period?
Anyway, period.
I'm crying. All right, let's go ahead and get that set up. I'm going to go ahead and help you as well. Thank you for getting that started. We're going to go ahead and put them elastic bands or the O-rings on there, okay? And looking good, looking good. All right, it may take a couple more seconds. All right, just to put these finishing bands on there. And then lastly, we just got to trim the wire. You don't want any excess wire from them arch wires that we put on sticking out. It's going to cause unnecessary pain, uncomfortability, or it may even damage the inner part of your gums, scraping them, or the inner parts of your cheeks, you know, scraping them. Sometimes it gets caught on food as well, so it may break your wires, which may you may have to come back, you know, and get them fixed. So to prevent that, we're going to go ahead and trim the wires. And if the wires do come unloosen or loosen up over time, always come back. You know, if they snag on anything, come back. If they're causing any pain, come back to us so that we can fix that and trim the wire again, or just fix it. Okay. So like I said, we're gonna go ahead and trim the wire. Certified. Oh, dang, you already on it. Thank you. I appreciate you. We trimming the wire over here. Good look. Okay, everything looking good now. You got a nice, healthy smile. Everything looking good. Teeth are in good condition, nice and clean. Your braces are on in perfect condition. I'm going to go ahead and hand you the patient mirror so that you can take a look. Go ahead and smile and tell me what you think, if you like it, if it's comfortable.
What the fuck wrong with you, man?
Just let me know what you think. Thank you.
I'm not gonna lie. You did a good job. I love you so much.
Thank you. Awesome. It wasn't just me. I had, my helpful assistant here, Miss Certified Queen. So she got you right too. Don't worry. All right. Certified, can you go ahead and take some after pictures? We're gonna go ahead and upload that to the patient portal as well, okay? And then once you take the after pictures, what I'm going to do is show you the before and after pictures so you see how you came in and you see the transition on how you about to leave out. All right. So bam, there you go. Before and after. We going to get that updated to the patient portal. We're going to get that updated in your info packet so you can take that home as well. All right.
How the fuck I get out of here?
All right. And lastly, Certified, can you go and I'm gonna get this script together. Can you go and get some Advil and some Tylenol, please? I'm gonna go and get a script for her and write this out for her. I don't want you having any unnecessary pain. With braces procedures, with them being tight, they can cause a little bit of pain and uncomfortability until you get used to it. So I'm going to just go ahead and prescribe you just some slight medication, okay? And Certified is going to go and hand it to you. So I'm going to prescribe you 200 milligrams of ibuprofen, which is basically Advil. That helps with the inflammation. And then I'm going to go ahead and prescribe you 500 milligrams of acetaminophen, which is basically just Tylenol. And studies have proven that Tylenol doesn't only help with pain, it helps with teeth movement. So it's really good in terms of making sure your teeth stay nice and steady while the braces do what they got to do, okay? And that's perfect. You know what I mean? I'm also going to go ahead and prescribe Well, I'm gonna recommend you getting a benzocaine. Benzocaine, you can get that from your local pharmacy. That's Walgreens, CVS, Rite Aid, Safeway, whatever your local pharmacy may be. I recommend going ahead and getting benzocaine. It's basically just a topical ointment like Orajel, and you rub it on your gums for any irritation or any uncomfortability. All right. And that's pretty much it. You could take your gown off. I'm gonna go ahead and hand you your goodie bag. All right, and you're gonna be set. Okay, make sure everything's good. All right. I'm gonna update these pics into your dental portal. All right, and let me go ahead and hand you. Thank you for that. I appreciate you, certified. Let me go ahead and hand you the dental goodie bag. Okay. Or can you go ahead and get it for me? It's in that cubby hole right there in the closet. Go grab it for me, certified, and then you can hand it to me. You see that the cubby right there in the corner?
Here?
Yes, ma'am. You see it? It's in there, right? Yep. There you go. Yep. I keep my goodie bags in there. Thank you. Yes, ma'am. And I'ma just grab that from you. Thank you. And I'ma hand it to her. Thank you so much. And like I said, the goodie bag just is basic stuff that to help you keep with upkeep with your dental hygiene when you go home. A little brush, toothpaste, things of that nature, floss, maybe a little bit of mouthwash. I recommend getting I recommend not using Listerine. Studies have proven that Listerine has alcohol in it, and alcohol tends to dry your breath out, causing bad odor, or pretty much having you to do it more than once or twice a day, which kind of defeats the purpose. So try to use something else, another mouthwash, okay, other than Listerine or other than mouthwashes that have actual alcohol in it, okay. Other than that, try to brush twice a day. That's very necessary in the morning and at night. All right, and floss once a day. You could do it at night or you could do it in the morning. It's up to you. All right, and then I always recommend rinsing your mouth with warm water, warm salt water at that. You could get a cup, put a little bit of salt in there, put some warm water, mix it up with a spoon or your finger or whatnot, and just swish it in your mouth, spit it out. It helps with inflammation. It helps keep your mouth, clean for the most part. Just rinsing it out. All right. And also, it's normal to feel any sensitivity with hot or cold items within 24 to 48 hours. That's 1 to 2 days after this procedure with your braces. So if you feel any other sensitivity that lasts longer than that amount of time, please come back, okay? And avoid eating also with at least 30 minutes to an hour after this procedure, okay? And that's it. All right. Everything is updated in the portal. Certified, can you print her out a copy or can you go grab it from the printer? I'll print it out for you. You can go grab it and hand it to her, okay? The gown is already off. Everything looks good. You could also grab her discharge papers too. So you could grab the copy of her info packet and her discharge papers. Awesome. And then you can hand it to her and she'll be all set. Everything is all good now. Awesome. Looking good, looking good. And then you're all free to go, Miss Rihanna. We appreciate you for coming through. And getting your smile nice and healthy, back in tip-top shape. I'm gonna go ahead and drop my tag for you.
Thank you so much. I love them all.
No problem. Of course, anytime. Like I said, it's what we love to do. All right, making the world a better place, one smile at a time. That's what we do, baby. So we got you set up. You're all straight. Oh, let me dance with her. Ooh, ooh, ooh. Hey. Yes, ma'am. I'm gonna go ahead and let you out. All right. And we gonna go ahead and finish up by just making sure that the room is sanitized, disinfected, all the equipment is now sanitized, disinfected, the TV is turned off, and then the computer systems and the machines are also turned off, okay? And you can I can assist you with that. Just let me know, okay? Turn off the TV, turn off the computer system and the machines. Awesome. And I'll help sterilize some of the equipment too, so it makes it a little easier.
Your ass up.
Awesome. I helped you with it a little bit. Let's see. Did you get the TV already? You can get that TV, turn that off. I'm gonna go here and make sure all the bugs and glitches out the computer is good. For the next person, turn this off. Awesome. Everything looking good, looking good. All right, and we just going to go ahead and turn the lights off for the next person to come in, and I'm gonna secure the doors. Awesome.